Today we're breaking down Beck's cognitive behavioral therapy, not as a theory, but as it appears on the EPPP. To pass this exam, you must understand layering. CBT is not just definitions, it's structure. Let's start with the model's assumption. CBT is based on the idea that psychological distress is largely due to maladaptive cognitive schemas, automatic thoughts, and cognitive distortions. 3 layers. If you can identify the layer in a vignette or test question, you can identify the answer. Layer 1. Schema. Schemas are deep core beliefs. They develop early in life through experience and biological vulnerability to stress. They are enduring. They shape how information is processed. For depression, remember Beck's cognitive triad: negative view of self, negative view of the world, negative view of the future. If a client says, "I am worthless, I will always fail, nothing will ever get better," that is schema-level thinking. The exam may not use the word schema, but if you hear global, enduring beliefs, think schema. Study insight. Thinking. Schema should trigger Beck's cognitive behavior model, nothing else. They are not trying to trick you. Know your models and which language belongs to which model, and you will move more easily toward answers that align with the correct answer. Layer 2. Automatic thoughts. Automatic thoughts are spontaneous interpretations triggered by a situation. They come between an event and the emotional reaction, event to thought to emotion to behavior. For example, event. A colleague walks past without saying hello. Automatic thought: she's upset with me. Emotion, anxiety. Behavior, avoidance. Automatic thoughts are fast. They can be positive or negative. In CBT, these are the first targets for intervention. You do not dismantle a schema immediately. You examine the automatic thought. Layer 3. Cognitive distortions. Distortions are errors in reasoning inside automatic thoughts. Common distortions you must know: arbitrary inference, drawing negative conclusions without evidence; selective abstraction, focusing on one negative detail while ignoring the rest; dichotomous thinking, black and white thinking; personalization, assuming responsibility without evidence; emotional reasoning, I feel it, therefore it's true. On the exam, if the question asks what distortion is present, look at the reasoning error, not the emotion. Dysfunctional thought record, DTR. The DTR is structured CBT homework. It includes event or situation. Automatic thought, emotion is rated 0 to 100. Alternative rational response, outcome. That 0 to 100 intensity rating is testable. If you see mood monitoring, thought tracking, or structured evidence testing, think CBT. Techniques. Cognitive techniques include redefining the problem, reattribution, decatastrophizing. Behavioral techniques include activity scheduling, behavioral rehearsal, exposure, guided imagery for relaxation. If the vignette describes structured homework, behavioral activation, or gradual exposure, that's CBT. Collaborative empiricism. This is critical. Collaborative empiricism means that the therapist and client act as co-investigators. They examine evidence together. The therapist is active, structured, and goal-oriented. CBT is not an insight-oriented exploration of childhood. It is present-focused and evidence-based. Socratic dialogue. Socratic dialogue involves strategic questioning. What evidence supports this belief? What evidence contradicts it? What's another explanation? What happens if you continue thinking this way? If the therapist uses guided questioning to test beliefs, that's CBT. Final application rule. When answering CBT questions on the EPPP, ask yourself, is this a schema, an automatic thought, or a distortion? Is the intervention structured? Is the therapist examining evidence? Is homework assigned? CBT is active. CBT is structured. CBT targets faulty information processing. If you see those elements, you are in CBT territory.